Ebola. If you had to pick the disease right now, at this very minute, you were the most scared of, what would it be? Maybe Ebola? Ebola is a scary disease, partly because it's highly contagious, and partly because it's proven very deadly. By May 2015, Ebola has killed more than 11,000 people in Liberia, Sierra Leone, and Guinea. The West African countries hit the hardest in the recent outbreak that started in earnest in early 2014. But there's also lots of misinformation swirling around it, including who is at risk of getting Ebola, a situation somewhat understandable given that it was first identified only a few years before HIV/AIDS. Ebola first attacks the immune system, weakening a body's defenses before moving out more broadly into a person's body. It attacks quickly and very often lethally, bringing fevers and other symptoms often common with viruses, as well as hemorrhaging, severe bleeding. Because of how extreme Ebola's symptoms can be, how deadly it often is, and how little we know about it, this virus has made a lot of people afraid, and all too often that fear has been directed at the people who are sick. The fear of Ebola and the widespread stigma against Ebola patients contributed to an underreporting of Ebola cases to health authorities in the most affected countries, meaning a lot of people who had Ebola didn't tell anyone that's why they were sick. It's also why we're not sure how many people died, and why there's such a wide range of 50 to 80% in the case fatality rate. Underreporting, if it happens, is a serious challenge when trying to control an infectious disease. If doctors, nurses, and other health workers don't know who's sick, it's hard to get people the help they need and to prevent them from infecting others. Fear also all too often leads to stigma around victims and survivors of a disease. In April 2015, I was honored to meet a group of Ebola survivors in Liberia and was heartbroken to hear how many hadn't gotten their jobs back or their friends back because people were still afraid of them even after Ebola had left their bodies. Ebola is spread through contact with an infected person's blood or bodily fluids, and it can be transmitted through something that an infected person has touched or worn or a bed they've slept in, which makes it very different from HIV/AIDS. Ebola is not transmitted through the air. Unlike what's true for many viruses, however, Ebola can infect others even after a victim's death, at least for a few days. Because Ebola is so powerful, the protective gear, full body suits, goggles, and gloves you may have seen in the news is important for doctors, nurses, and others working to treat people with Ebola, so that people with Ebola can receive the medical attention they need to get better, and healthcare workers can be protected while doing their jobs. It's also important for those working with the bodies of Ebola victims. The absence of enough safe, full-body protective gear for everyone on the front lines of the recent Ebola outbreak helps explain why Ebola has taken such a tragically heavy toll on doctors, nurses, and other healthcare workers, killing more than 500 in 2014 alone. Ebola's ability to spread in so many different ways helps explain why it can move so quickly within families and communities, infecting along the patterns of love, care, and support that normally sustain us. Many people have lost multiple family members to Ebola, and those who had cared for the first Ebola victims didn't have the necessary protective gear and became victims themselves. There is currently no approved vaccine for Ebola, though different groups are working on developing one, and active tests, technically known as trials, of potential Ebola vaccines are occurring in Sierra Leone and Guinea, and there may be a vaccine by the time this book comes out. There are also active tests ongoing to determine which experimental antiviral treatments for Ebola might prove most effective. The absence of approved and broadly available medicines has meant that most treatment of Ebola patients relies on what is known as supportive care, making sure people who are sick don't get dehydrated and treating other infections if they happen so that a patient's immune system has the breathing room and strength to fight off the Ebola virus. In the US and other countries with strong health systems, we have built in protection against something like Ebola that people living in places like Sierra Leone, Guinea, and Liberia don't have yet. We have a robust network of government health officials, hospitals, clinics, lots of doctors and nurses, people who are trained to look out for diseases at airports, seaports, and other border crossings. In other words, we are much more prepared to spot possibly scary infectious diseases quickly so that people can get the treatment they need in a safe environment, increasing their ability to get better and decreasing their ability to infect anyone else. That's why in the US, we've only had 4 cases of Ebola, and 3 of the people recovered. Lots of people are still scared of Ebola in the US because it's scary, but it's far from our greatest infectious disease threat. A core part of our robust network is what's known as the CDC, or the U.S. Centers for Disease Control and Prevention. If you have more questions about Ebola, including how to protect yourself from Ebola if you're ever in an area with an Ebola outbreak, please visit cdc.gov.